Today I'm going to be talking about breastfeeding, and my patient is in a hospital setting after having her first baby. I'm just going to help her with the process and explain why it's important. First, I'm going to be going through the pathophysiology of how breast milk is made. So during pregnancy, the development of glandular tissue completes and help produce that breast milk through the help of estrogen and progesterone. You actually have development of glandular tissue during puberty, but it finishes during pregnancy. And then prolactin is also required during this process. Next, I'm going to be going over why breastfeeding is important. So for the mom, it helps the body to recover from pregnancy or labor because it helps shrink the uterus back to size and help reduce bleeding. After childbirth, when you breastfeed exclusively, your milk supply builds up quickly and helps to achieve your breastfeeding goals more easily. Another important point is breastfeeding helps with bonding with your newborn. The skin-to-skin contact is an important step for you and your baby to familiarize yourself with each other and help the baby build trust. Breastfeeding also saves time. Unlike formula, breast milk is always the right temperature and it requires no bottle to wash and clean. Also, it saves money because breast milk is the only food your baby needs for the first 6 months of life. And then for the baby, breast milk is rich in antibodies which help fight infection. Also, with vitamins and nutrients your baby needs, it helps build the immune system and helps with brain development. And also the baby will be less likely to get hospitalized for pneumonia, less likely to develop asthma, some cancers, and diabetes. Overall, babies who are breastfed get more health benefits than formula, and it's much easier to digest. Next, I'm going to be discussing how to get a successful latch. So first, you want to bring your baby to breast and tickle your baby's lip with your nipple. This will help your baby open their mouth wide. And aim your nipple just above the baby's top lip and make sure your baby's chin isn't tucked into their chest. And then aim your baby's lower lip away from the base of your nipple, and the baby's lip should be turned outward like a fish. And your baby should lead into your breast, chin first, and then latch onto your breast. Your baby's tongue should be extended and your breast should fill your baby's mouth. This is when you want to make sure you get as much of your areola in the baby's mouth as possible. And then watch and listen to see if your baby is sucking and swallowing easily. So signs of a good latch is the latch should be comfortable and pain-free. Your baby's chest and stomach rest against your body, so the baby's head is straight and not turned to the side. Your baby's chin touches your breast. Your baby's mouth opens around your breast, not just the nipple. Your baby's lips turn out. Your baby's tongue cups under your breast. You hear or see the swallowing, and your baby's ears might move slightly as well. And if you're having trouble, some tips include moving to a quiet, calm place, holding your baby's skin to skin, or letting your baby lead. And if this is still a problem, there's always resources at the hospital, such as a lactation consultant, which I will also explain in greater detail. So nurses can help with psychosocial as well as physical needs for the mom and family. Since this is something new for my patient, the mom might feel scared and have a lot of questions. Therefore, I am there to support and talk to mom and family and to encourage them, positive feedback, and to give them a comfortable environment to allow bonding. And to reinforce how important breastfeeding is, for the physical aspects, I can help ensure there's support for breastfeeding as part of mom's care from all staff members. I can do this by keeping the baby in the same room as mom for easier bonding and feeding. And if mom or baby is having trouble, they may need assistance from specially trained healthcare professionals in this area and can help solve any breastfeeding problems. Next, I can help promote self-care and recovery for my patient. I will explain what happens in the first few days after birth. So mom may feel excited and maybe some relief because finally she gave birth to her beautiful baby. During this time, it is important to bond and familiarize yourself with new feeding schedule for baby. And then for the first 12 to 24 hours, the mom will feel tired because labor and delivery is very hard work and mom needs to rest. And nurses can help by providing a calm environment by either closing the blinds, turning off lights, or reminding friends and family that mom needs rest. And during this time, it is normal for baby to sleep heavily, so when baby sleeps, mom should sleep too. And for the next 3 to 5 days, mom's breast may feel full and leak. So asking friends and family to help with baby, such as changing diapers and so on, can help mom with the resting period. So a problem that can happen for mom is producing too much milk. And some signs that this is happening is that the breasts feel very full or hard. And baby may choke or sputter during feeding, which makes them become really full really fast, so feedings become short. And what mom and nurse can help mom do is to hand express breast for a few minutes to relieve pressure, to give cold compress to reduce any discomfort or swelling, and to burp the baby often because they're getting too much. And the opposite problem can also occur, which is too little milk, which some causes are poor nipple latching, postpartum hemorrhage, mom has a history of diabetes, thyroid, or hormonal disorders, and some signs include breasts do not leak any milk and a very fussy baby because baby is hungry. So something mom can take to help increase milk supply is a galactagogue or fenugreek, which is taken orally 580 to 610 milligrams, 2 to 4 capsules, 3 times a day, or a powder form, which is 1/2 to 1 teaspoon 3 times a day. It can cause interactions with anticoagulants and hypoglycemic agents, and some side effects include dizziness, making sweat and urine smell like maple syrup, and some mild GI effects such as watery stools. Contraindications for this herb has not yet been identified, and it's still unknown if it goes into breast milk. The constituents of it. Nursing considerations include insulin might need to be adjusted because if mom is diabetic and this causes interactions with hypoglycemic agents, it shouldn't be combined, as well as anticoagulants. Education to provide for the patient would be sometimes the baby will have green watery stools and become fussy. This is because the herb is working and it's just an overabundance of milk supply. Also, the baby can also smell like maple syrup, which is an interesting point. Some concerns or fears mom can feel are the feeling of stress because it can become overwhelming to keep up with baby's feeding schedule. Baby will most likely eat 8 to 12 times in 24 hours, and feedings can take 15 to 20 minutes each time. Mom can also feel unsupported. For example, husband or significant other may not be helpful, and mom may get irritated, especially if baby is also having a hard time getting used to feeding. Another important concern is breastfeeding in public, because in society it can be looked down upon for some reason, but the federal government and some states have laws to protect for nursing moms. So it is just important to believe in yourself and your choice to breastfeed your baby, to remind mom that you can succeed, and to just wear your confidence, because if someone criticizes you for breastfeeding in public, it's important to know the laws where you are and don't be afraid to respond. Most of all, it is important to remember that you are meeting your baby's needs. So it isn't possible to stay home all day, and you should feel free to feed your baby while you're out and about, and you should be very proud of this commitment. Some tips are to wear clothes that are easy to access the breast, like those clip-on tank tops for nursing moms, and to use a breastfeeding blanket. So some resources to help mom cope with being a new mom and feeding her newborn include a lactation consultant, which I did mention a little bit before, but they help in the hospital with latching difficulties, painful nursing, low milk production, or if baby is not gaining enough weight. Another resource is a doula. They help provide emotional, physical, and educational support for mom. And this can be a mom that's expecting, in labor, or already gave birth, like my patient. Their purpose is to help mom have a safe and memorable experience overall, and they can also help in your home during the first few days or weeks. And another resource is a mother-to-mother support group, and this is just a group of breastfeeding mothers who can help share tips and offer encouragement to the new mom. And there's also a WIC program, which offer health services for low-income families, and they can help with peer counselor support, breast pumps, and other supplies. And here is a website to learn more if it's applicable to the family. And also, family is a great source of support. As a nurse, ensuring that the family relationships are healthy is one of the first steps of a safe environment for the baby to go home to. All in all, breastfeeding is just such a great way to bond with the baby and help provide nourishment that the human body created. So it is such an amazing thing to experience and to understand how important it is for the baby. So I loved going through this information and just providing my patient with the best. And finally, here are some references I use for the pictures and also the information. And thank you so much for listening to my presentation. I really enjoyed the content, and thank you.